There we go. That way you guys actually have something to watch. All right, so let's get to it. So a little bit about myself. Not I've never met any of you to my knowledge before, so I'm going to introduce myself a little bit, and then we'll start getting into it. So I live in Seattle. I just actually celebrated 20 years of marriage with my husband, which was really exciting. I love baking, roller skating. I love sitting around a fire with a good glass of wine. I actually weirdly like doing yard work. Maybe that I'm a new homeowner for just a few years, so maybe it's kind of just it's something I'm proud to do, I guess. And I have a quirky little hedgehog named Dr. Pickles, who we have some fun with. She's very amusing. My professional background, I have worked in physical medicine for about 20 years. I was trained to help patients carry out their therapies, and as well to counsel them through anti-inflammatory guidelines at home. Eventually, that turned into a role of counseling them through more specific guidelines. So they would get food sensitivity testing, and I would walk them through that and how they could best utilize those results to help them with inflammation while they were undergoing intensive physical medicine treatment. So they complemented each other. That was my main role. And that sort of inspired my nutrition career. It was a combination of that and as well as my own journeys along the way. You know, I've had health issues for many, many years that I've been trying to work through and was kind of let down by many of my providers. So I've done a lot of the work myself. And, you know, combined together, those two things really helped to inspire me to formally study nutrition. And so that's what I'm doing now. I launched Well Roots in June of 2021 and have been just the sole practitioner here since then. And I became board certified in holistic nutrition just last year. So that was a pretty exciting move for me. And so what I do in my practice, my real goal with every person I work with is to help them to build and rediscover their intuition. We're finding root causes of symptoms instead of just trying to suppress the symptom. So my goal as a holistic practitioner is to really get to the root, to the why behind why they're having symptoms or why something's showing up on their blood work. And we work together, and that also helps them to build autonomy and learn how to advocate for themselves at the doctor. So, how to ask questions and hold their healthcare practitioners accountable when something does not seem right. I'd like to do a land acknowledgement. I want to acknowledge that I live and work on the traditional land of the first people of Seattle, the Duwamish people, past and present, and honor the gratitude, with gratitude, the land itself of the Duwamish tribe. If you are, it sounds like some of you are in the Seattle area. If you are in the Seattle area, I'm going to provide a link in that email for you of ways that you can learn more about the Duwamish people and how they can be supported today while they're still trying to regain some power over the land. All right, food sensitivity versus food allergy. This is what I want to cover first because these terms often get confused, or just used interchangeably, and maybe it's just a not even a thought in people's minds, but in my mind, they're very different. And so I think it's important to differentiate them and talk about what that looks like. So both food sensitivities and food allergies are an immune system response to foods, and it's mediated by antibodies called immunoglobulins. Don't expect you to remember that word. So they are Y-shaped proteins that are produced by a type of white blood cell called B cells. So that's part of your immune system. When you hear white blood cells, you think inflammation. So they are both a type of an immune response. Food sensitivity characteristics are going to be delayed response. Symptoms are often more subtle, and we don't tend to think of them as being correlated with food. You know, when you think about like, oh, if a food affected me, it's going to, you know, make my stomach hurt or I might get a rash or something like that. But they're typically more delayed responses that we would not typically think, oh, that was probably the corn I ate last night or something like that. Um, Typically does not present a fatal threat. And immunoglobulins typically involved in food sensitivities are going to be called IgG, IgA, and IgM. And we'll talk more about that specifically in a bit. All right, so food allergy characteristics. That's a more immediate response, typically within seconds or minutes of eating or being exposed to the allergen. Symptoms are much more obvious usually, so redness, swelling, itching, rash, or hives. Allergic response can be life-threatening. And IgE is the immunoglobulin responding to an allergen as opposed to the food sensitivity. So it is an antibody, it is a type of immune response, but it's a different type of immunoglobulin that's involved in allergy response. So how food sensitivities develop? There can be some genetic components, just like with allergies, you can be born with certain types of allergies. Allergies are actually still not well understood. um, but food sensitivities, we do know that a lot of them can come from just a poor breakdown of the foods that we're eating. So I'm going to give you a little bit of 101 here on digestion. When we do ingest food and it moves from our stomach through the small intestines, that's where the majority of the breakdown happens. And those nutrients actually they cross through the small intestine wall into the bloodstream. That is how we get our nutrients. Um, what happens in a food sensitivity is when the food is not broken down properly into its smallest nutrient form, enters the bloodstream, and that can cause our body to react as if it's a foreign invader, like a virus or bacteria, because it doesn't recognize the form that it's taken. And so that's typically modulated by those B cells that we talked about, the immunoglobulins. And then what ends up happening, just like with other types of pathogens, is we get these B cells that stick around and they become what's called memory B cells. And that helps them to remember. So let's say you develop a food sensitivity to blueberries. Now, every time you eat blueberries, your immune system is going to remember that and it's going to react with an immune response. All right, so possible reasons for inadequate digestion of food that could involve a lack of stomach acid, intestinal hyperpermeability. So you might have heard this called leaky gut syndrome. So there are these what are called tight junctions in your small intestines. I talked about the nutrients crossing through that wall and into your bloodstreams. That goes through this kind of tightly woven tissue that lines your small intestines. And for various reasons, it's a little bit chicken and egg. We don't know which comes first, but sometimes that those tight junctions start to loosen, there becomes inflammation. It could be due to a pathogen, it could be due to just long-term poor digestive health, it could be a number of different things. But that can cause that hyperpermeability. So you imagine if those holes get bigger, they allow bigger particles through before they're ready to be put through. So that's that intestinal hyperpermeability. GI hormone issues, so gastrin, cholecystokinin, secretin, these are all hormones that are involved in digestion. And if those are not, and they do various things like stimulate certain digestive enzymes or the stomach acid itself. If those are not working properly, and that could be a number of issues as well, then your foods are not going to get broken down properly. And the other big thing that I see with people is that we're eating in the state of an activated sympathetic nervous system. So you might have heard that term before. We know it as fight or flight. And what we need to be eating in is this rest and digest, the parasympathetic nervous system response. And we'll talk a little bit more about that going forward. I'm going to give a little room for any questions, thoughts so far. So a lack of food diversity can also lead to food sensitivity. So it's not, there's not good evidence to prove this, but it's speculated, and I think that it makes sense that the more frequently we eat something, the bigger the likelihood that we're going to develop a food sensitivity, because we're increasing the likelihood that it's not going to get broken down properly. So if we're the person throwing a handful of, or we're making the same smoothie every day, let's say we buy this big 2-pound bag of spinach every week, and we buy a container of blueberries, and we buy, apples and bananas, and we're throwing those same ingredients into our smoothie every morning, then that's a good recipe um, for developing food sensitivities. Is just eating the same things over and over again and not putting variety into your diet. So symptoms of food sensitivities can range. I mean, they spread wide, but I'm going to talk about a few here that might be more recognizable. So a racing pulse, even just right after you eat, can actually be a sign that you might be sensitive, or you might start to react to that food. Having a runny nose, stuffy head, sinus congestion, tinnitus, so a ringing in your ears, can also be a sign of that congestion in your sinuses. Increased pain or soreness. If you already have an injury, you might notice that it feels more inflamed within the next day or two. Um, Stiff, achy muscles or joints can be a sign of a food sensitivity. Headaches and migraines. Having a phlegmy cough, so like a really wet cough. Increased IBS symptoms, and increased symptoms of other conditions. And I know that sounds probably pretty vague, but what that means is, like, if you have like an autoimmune condition or some other kind of illness that sort of gets exacerbated with inflammation, those symptoms can also be exacerbated if your immune system is reacting to a food sensitivity. All right, so impacts on your health. Like, why is this important? Why do we want to know about food sensitivities and address them? Unaddressed food sensitivities, just like unaddressed gut pathogens and other underlying stressors, perpetuate chronic inflammation. And we'll go into that a little bit here. So chronic, we start with this underlying stressor, and those can be very subtle also. We think of stress as this outward thing, like, oh, traffic, I have work meetings, I have to get, kids to their activities on time. Whatever the outward stressor is, but we have all these internal stressors as well that we're not really totally aware of, that our body is reacting to as though we're fleeing a tiger. It's the same stress response. And so if that stress response is activated, then this is going to lead to that chronic inflammation. So we start with this underlying stressor. And then that becomes heightened stress response. So that sympathetic nervous system kind of gets stuck in on mode unless we're actively either addressing the stressor or actively doing things like breath work that can kind of switch us back over into that parasympathetic. And even then, it's only going to be temporary until the sympathetic kicks back in to continue trying to fight the stressor that still exists. Cell danger response. So this term was coined as an umbrella term, talking about when stressors when stressors exist and then our body tries to respond to it and those stressors don't go away. What happens is a cell danger response, and that involves the cell stiffening their walls. So normally a cell wall is very permeable, it's very soft and pliable, and that allows nutrients to travel across the cell membrane. They stiffen their walls as in an effort to prevent that from happening. They're trying to preserve energy. They send out help signals to the immune system, and that in itself is an inflammation response. They'll even deactivate thyroid hormone at the cellular level. So this cell danger response is a result of this heightened stress response over time that does not get dealt with. And then that leads to chronic illness. So if we think about all those, all those stressors just continuing to infiltrate our body, and our body's just trying to deal with it. What it ends up starting to do is it starts to overreact. It starts to react uh, um, like erratically, really. It's just trying to just do whatever it can to figure this out because it needs some help. Um, so what I like to do is give my clients a picture of this stress bucket. So if we think of our body as this bucket and everything that we're throwing at it, and it might be things that you've never even considered, all of these things can be stressors. When they're, especially when they're left unaddressed, is when they become fillers of the bucket. They start to fill that bucket up. We can remove the stressors and deal with them, and that's going to bring that level down. But if you think about when you have like a cup that's full of water, it's full to the brim, or a bucket, what happens when even one drop of water lands in that glass? It's just going to overflow. The surface tension is going to break and it's going to go everywhere. It can't contain it anymore. It can't deal with it. Um, and so that's your body. Your body's just trying to deal with everything that we're throwing at it. And so that's where food sensitivity can be helpful, is we're seeking out root cause answers to be kinder to your body and give it support that it's calling out for. So again, it's a really subtle stressor that we may not recognize as being a factor in inflammatory processes and chronic illness. All right. Questions or thoughts so far? We're actually getting through this pretty quickly, so everyone with me? Okay. All right, so types of food sensitivity testing. Now, this is like, it really is a matter of preference. Usually, like the practitioner will have a specific preference for what kind of testing they like to do. There's pros and cons for each of these, and neither one, I think, is really superior to another. It's just having information and understanding the nuances and the ups and downs to each of them. Really, the only way to test for this, besides doing the elimination or challenge method, is by blood. So it needs to be a blood draw or a dried blood spot. And even some would argue that the dried blood spot is not accurate. I've looked at the research and I don't think that that's true, but some might say that. So commonly what you'll see are food sensitivity tests that test for IgG and IgA. They're not typically testing for IgM, and there are also some subcategories of IgG that they might test for, and that gets way more complex than what we're going to talk about tonight. But most commonly, when you see like a food sensitivity test, it's going to be an IgG, and then sometimes it will also add in IgA. Now, IgG is definitely, it's present more in the blood. So if you think of G like general, it's just present in your bloodstream. So it's kind of always looking for things. IgA is going to be in the mucosal tissue, the mucosal lining of your tissue. So that's going to be more present in your gut. It's going to be more present in your lungs, your sinuses, your intestines, your colon. That's where IgA primarily lives. And then we have a test called MRT, which is a mediated release test. This is what's called an endpoint test, meaning what they're looking for is indications of inflammation. They're not looking for the immunoglobulins necessarily. They're not looking for the path that it took to become inflamed. They're looking for the signs of inflammation at the end, no matter what path that took. And then the elimination challenge method is the gold standard for a lot of holistic practitioners still. It is very difficult to execute properly and can be very lengthy and arduous, which is why people don't do it. So again, it's that there's pros and cons to it. And that's why these other tests exist. So it kind of just depends on your preferences. But these are generally the types of tests that you're going to see if you're looking into food sensitivity testing. Yes.
Uh, is it okay to say something?
Yeah, go for it, Marilyn. Yeah.
Okay. The IgA, if the IgG is blood, how do they do the IgA if it's in your tissues?
All three of those are going to be a blood test. So the IgG, IgA, and MRT are all a blood test. What they're going to see is the IgA response to a food. So it will be present in the blood, but IgA immunoglobulins are sort of living and waiting in your mucosal tissues. That's kind of their line of defense.
Okay.
Other questions or thoughts? All right. So I'm going to go over kind of the ups and downs of each of these types of testing. So the benefits of IgG and IgA testing, it's more helpful to understanding symptoms because of what we talked about, where the IgG tends to live and where the IgA tends to live. Um, those symptoms are a lot more easily recognizable. So like I know that if IgA is highly reactive, it's probably, and this is not mutually exclusive, but it's pretty typical that symptoms are going to show up as like sinus congestion, runny nose, phlegmy cough, those mucosal types of reactions. Whereas IgG, a reaction is going to be achy, stiff, increased pain, just kind of a more general body response. And so I think that the symptoms are more easily recognizable with IgA and IgG testing. Um, it also is a good representation to how your immune system is reacting. And it's helpful, I think, when both IgG and IgA are tested because then you can differentiate the two between the two. And then this one can also be done with both a blood draw and a dried blood spot. So there are home testing kits that you can do with the IgG and IgA testing, which is really helpful for a lot of people. The downsides are immunoglobulins are not in and of themselves a sign of inflammation. It could lead to inflammation, it could not. If it takes care of the thing that it's trying to take care of, you may not have a chronic inflammation factor. So it's not in and of itself a sign of inflammation. Um, so it's a good starting point, but that is one downside to it. And results will vary in accuracy depending on what foods you ate prior to testing. So that will change how your test looks. And if you're doing even multiple tests, if you're doing a test and then you do sort of a like an elimination or a rotation type diet to try to overcome the food sensitivities and then you test again, you might have some variations in there that don't quite make sense. That's pretty normal. It's hard to make those factors the same across the board. And so that can lead to inaccuracies in the testing. Pardon me. So benefits of MRT testing. It is more specific regarding inflammation. So like I said, it's an endpoint test. So it's looking for the inflammation factors specifically. And what I really like about MRT is that it tests for food and chemicals. And I have not really seen a good IgG or IgA test that also tests for like food, like chemicals or additives that you might see in foods. So that is one big benefit of MRT. Again, results vary depending on what foods were consumed. Same as the IgG, IgA test. It can be more difficult to recognize your symptoms. And it's really difficult to get an MRT test. You can't go into like a LabCorp to do it. What we have to do is special order a kit that you take to a special lab that actually does MRT testing. And then they'll usually like arrange shipping it out for you, but it's just it's harder to get that test done. Unless you go into like a clinic that actually does the blood draw themselves. Benefits of the elimination challenge method. So if done properly, the results are more accurate. And symptoms are more recognizable because it's really the person doing it and saying, I ate this and I'm journaling about this. I've kept a record of everything. So I can see more clearly that this food is related to this symptom. So symptoms are a lot more easily recognizable. The downside, it requires careful strategy, requires time, requires extensive food diaries. And many food sensitivities are dose dependent, meaning you might test, let's just go back to blueberries. You might test blueberries by eating, let's say, 10 blueberries, but maybe your body is sensitive to it, but maybe only if you eat 20 blueberries. So it's dose dependent, and you may not have had a reaction until you ate more of those blueberries. And then next time you eat, you sit down and you eat a whole bunch of blueberries, which is really easy to do, then you're going to react and it's going to be kind of confusing. So food sensitivities are typically dose dependent, and so that can alter the results that you get from the elimination method. So they all have their pros and cons. What's really helpful is having a practitioner or someone who is qualified to help you navigate the results. I see a lot people who come into my clinic who will talk about having food sensitivity testing done that they never did anything with because they didn't understand. They were just like, I just avoided the high reacting foods. And that can be helpful. That can help you to eliminate symptoms. But the good news is you can overcome food sensitivities in a lot of cases, or at least reduce their reactivity. It's reducing those stressors and helping your body to recognize that it's safe to eat blueberries. Blueberries are not a threat to our body. And that would also involve a more holistic approach of like also improving digestion and making sure hormones are working properly, and all of that put together can really help your body to understand that blueberries are not the enemy. Just sticking on blueberries today. So yeah, like we talked about, it is possible to get rid of a lot of food sensitivities. It does take time and diligence, and it involves a strategy of rotation and elimination, and it looks different for everybody. And for some people, they just have it forever and just avoid the food forever, and that's okay too. But there are many cases where we can lower that reactivity to those foods. All right, let's talk about preventing food sensitivities. Focusing on digestive health. So this is where we kind of get into that parasympathetic, sympathetic um, response. A lot of us are usually eating while we're driving, while we're doing dishes, while we're feeding the family, while we're doing these other things. We're multitasking, we're watching the news, we're working, whatever the case is. Even if it doesn't seem like a stressful activity, we're still not in parasympathetic by doing those things while we eat. So, mindfully eating is one way to really effectively improve your digestive health. So, making sure you're sitting down to your meals, um, playing with your food, cooking your food is really helpful. Not all of us have the capacity to cook our own meals all the time, but if you are someone who enjoys cooking and has the capacity for that, cook with your food, taste your food, smell your food. All of that are ways of getting your body into that parasympathetic nervous response and getting out of sympathetic. Eating for variety. So if you are, I just use smoothies as an example because I know a lot of people have a smoothie habit, right? It's kind of their routine. We go to the store, we get the same whatever 4 or 5 ingredients. We know we can have a smoothie every morning for breakfast. I hear that a lot from people. So I'm just using that as an example, but this really goes across the board. But if you're that person of routine, and I am a person of routine, so I understand that, um, change it up. Like change the spinach out for something else, dandelion greens or kale or whatever a seasonal green might be. Change out the type of berry that you use. Change out the, whatever ingredients that you're using for that smoothie or for that meal. Try to make it different every week so that you're getting a bigger variety of food. Prioritizing whole foods. So ditching even a lot of like what we would consider health foods are heavily processed, especially things like animal product substitutes, protein powders. A lot of those are made with derivatives of real food that are then broken down into these compounds that our bodies don't recognize. And on a similar note to the eat for variety suggestion that I gave, is how often do we tend to like, okay, so we buy a protein powder and we start putting it in everything. It's in our smoothies, it's in our baked goods, it's in all these things that we make, and then we're getting that same food all the time. and especially these heavily processed foods that are more susceptible to becoming food sensitivities. So prioritizing whole foods would be a big factor in this as well. Minimizing other forms of stress where you can. So I know it's not just easy just to eliminate stress. It's something that we have to look at, I think, from a different angle and go, like, what is this stress saying about my life? Who do I choose to spend time with? What are things that I might be dealing with from my childhood, that need to be addressed? Things like that. Those are all things that we can help and get support for. And then we look more internally at like low blood sugar is considered a stressor. Digestive symptoms are a sign that some kind of stress is happening, delayed or missed periods, having energy dips, or even catching that second wind at night, that kind of fluctuation, that roller coaster of energy throughout the day, they are signs of stress in the body. Poor sleep quality is another factor of that. Physical pain can be a factor, especially when it's unexplained. Your body has ways of communicating, and it communicates through those symptoms. So just listening to what our body is actually trying to communicate, even if we don't understand it, that's where getting help from a practitioner can be really helpful. All right. So wrapping it all up, here are kind of the main points. We've talked about 5 main points. Food sensitivities are different from food allergies. They can develop over time as a result of poor digestion, processed foods, lack of food variety. Unaddressed food sensitivities can lead to chronic inflammation and result in things like autoimmune disease or other chronic illnesses. Testing options vary in accuracy. It's best to navigate the results with a qualified practitioner. And it is possible to get rid of food sensitivities. So if you have a food sensitivity test laying around your house somewhere and you're not sure what to do with it, it is possible to get over those food sensitivities.
I have a question.
Yes.
I can't tell if you,
Okay. Yeah, you're good, Lynn. What's your
okay.
question?
On this screen before this, when you were talking about things like prioritizing your whole foods, eating for variety, minimizing stress.
Mm-hmm.
Under, I think it was, let's see, focusing on the digestive health, where you say minimize beverages with meals. And I've seen that, read that other places, but I find that difficult. Like I like to take my supplements with my meals, which means I need to, have some water or
Mm-hmm.
kind of food with my. So what do you suggest there?
Do it. That's fine. It's really just minimizing. So I would say 2 things to this. So if you are drinking with your meal because you feel the need to wash down your food, then you're probably not chewing your food well enough, which is also impacting your digestion. But if you have supplements or something, or there's also in Chinese medicine, there's a belief that like drinking kind of warm or body temperature fluids does actually help your digestion. So there are factors like that that can be helpful. What we're trying not to do is we want to avoid diluting your stomach acid and enzymes. And that would be why I say minimize beverages. But if you have supplements or something to take with your meal, I mean, it's not very much that you're having to take very much fluid in order to swallow the supplements. So,
Hmm.
I would say that you're probably okay.
Yeah, because like I probably have like 6 to 8 ounces of water because I do my protein drink like with my breakfast.
Yeah.
And so that, is just a protein powder and water, not cold or hot, but just regular, like would be tap water, filtered water.
Yeah.
And I do that at breakfast. So I am drinking more probably at breakfast to take my supplements and drink that, but I'm not doing it because I do chew my food well and such. So is that going to be a problem?
I would say depending on what's in the protein drink, you know, you might have some issues there, but you're asking specifically about the water. What we're looking for is like non-caloric. So if we're drinking like black coffee or water, that's what's going to dilute things because the enzymes and acid don't have anything to break down. But if you're drinking like a smoothie or a shake, those enzymes and acid do have something to break down. And so they're not necessarily being diluted. They're actually working with what they need to and telling your body it needs those enzymes. So we're really looking at, maybe I should have specified here, non-caloric. We want to not dilute things. So if you're, yeah, if it's like a protein shake or even like a latte, something with milk, something that will have that your stomach and enzymes need to break down, that's acceptable. That's not going to dilute things. That's actually going to help stimulate those enzymes and acids.
Okay.
Does that answer your question?
It's sort of because I'm not doing a protein drink or any kind of mixture. It's just a scoop of protein powder of a um, uh, in a glass of water. But
Yeah,
there's not other things in it. It's just a plain protein powder.
yeah. And being that it's mixed with the water, sort in my mind, it makes it a protein drink.
Does it? Okay.
Yeah, yeah,
Okay.
yeah.
Okay.
That should be okay. It's you're still mixing those nutrients. It's just in a liquid form.
Okay.
So your body still has something to break down there. So I would say that that's on the other side of the fence from what we're talking about is minimizing beverages. Yeah, let's add the word non-caloric beverages into that. That might help you understand it a little bit
Okay.
better.
Yeah, it
Okay.
does. Thank you.
Yeah, you bet. What other thoughts or questions do we have?
I found this helpful. I've actually done elimination diets before, and they are hard and really just impossible.
Yeah.
But it's just helpful to know, just to do like a variety of food, because I do find that I get into a routine that's easy, that's like I don't have to think in the morning. I just go for my usual thing and that's it. And I don't have to, I'm still waking up, haven't had my cup of tea yet. So that's just a helpful reminder to have that variety for sure.
Yeah. Farmers markets are really great for that. And if I can offer, and I'll put this in your email too, I'll make a note of to myself to remind me. But since actually, Lynn, I didn't catch, are you in the Seattle area? Can you unmute yourself? Or just nod or shake?
Oh, yeah, I'm in Des Moines, about
Oh,
20
perfect.
south of
Okay,
Seattle.
then this will be relevant to all of you. So there is a book that I really love that's called Six Seasons, and it is specific to the Northwest, and it's written by an author. Like I said, I'll put this in your recap email too. His name is Joshua McFadden, and he's a like farmer chef. And so he really focuses on seasonal foods in the Northwest.
Hmm.
And it's not a vegetarian cookbook, but it is very veggie forward. And I love that because you can always add like a meat to something or like another kind of protein. But I've never made a bad recipe from that book, and it really focuses on that seasonal variety. And so you're able to kind of go to the farmers markets and get these local things and be switching it up all the time. It's an excellent book. I actually give it to my one-on-one clients who start up with the Reclaim Your Health program because I find it so relevant and just such a wonderful. I mean, I don't use recipe books, and it is like I cook from it all the time. So that's a really good resource for all of you since you're all in this area.
Can you repeat the title?
Six Seasons.
Six, S-I-X?
SIX. Here, I'll put it in the chat
Okay.
too for you. Here, let me stop sharing. And then where's our chat? There we go. And I'll put a link to it in your emails as well. My typing skills are not on tonight.
Seasons. Okay.
Seasons, yeah. So kind of he breaks it down, he breaks the Northwest down into 6 seasons as opposed to the 4. So I
Oh,
think he breaks summer into 2 seasons, early summer and late summer, and I think fall also. So it becomes 6 seasons since there's different things that are available in those times. Really, really
uh,
good book. He has one about grains also. That's fantastic.
um, I have a question. Actually, I have so many, I don't know where to start.
We have
But
time, so
yeah, I deal with, I mean, I've had food sensitivities for years. I've done all the sensitivity testing. I've gone through all elimination stuff, and I've been pretty good, except I also am dealing with osteopenia. I was actually osteoporosis, but I moved to osteopenia through
cool.
food and diet. Hopefully that's still there. And I also have IC, it's interstitial cystitis, which is,
Cystitis.
yeah. So I've been dealing with that, and all of this is all cured, or being able to live comfortably has to do with diet. Do you deal with that kind of stuff too? Or
Yeah, my understanding is interstitial cystitis, that's a hard one to say. IC is a
yeah,
much better term for it.
yes.
Is considered an autoimmune disease. And so typically where that comes from is chronic inflammation. So food sensitivities can help that, and that's probably why you've had some relief. As the type of work that I do, I'm also going to be looking at, so food sensitivity is actually usually a last resort for most of my clients. I look at food sensitivity testing. If my clients could just come to me with all of the money in the world and we want to do all of the testing, I think it would be really cool and helpful to do food sensitivity testing. What I find to be more of a priority in most of my clients is looking at gut health. So we're looking into things like gut pathogens, mold toxicity, heavy metal toxicity. Sometimes we'll just get some like thyroid blood work. So it kind of depends on what they're presenting with before we decide what kind of lab testing to do. And so that's where I'm going first, is typically the gut, because that's where a lot of this stuff starts. So if you've had success with food sensitivity testing and you've been able to you've been like reducing your stress bucket, right? So it's not overflowing anymore, which is amazing. We can look further into that and look at your gut and see what's happening there. Is your digestive system working properly? Is your liver functioning well, or is it congested? How's your bile quality? Are you breaking down fats okay? Is there some kind of pathogenic infection in your gut? I often see clients who end up having things like a candida overgrowth or parasite or small intestinal bacteria that we work to eliminate, and that allows everything to kind of calm down as well. So this is really just one piece of the puzzle, and as much as
Yeah.
I love it, it's usually a last resort for my clients.
Huh. I well, like I said, I had it, and that leads me to another question. I had my food sensitivity test done probably, oh gosh, years ago now. I'd have to look at the date. If I say something, it's probably double that. But I've been recently wondering if I need to have it done again because things change. I mean, so if I found what was sensitive and I cleaned up and I was doing really well, and now things are going south again, could that mean that my food sensitivities have changed over time, or do they always stay the same? I have this nice little card and it tells me what I'm supposed to stay away from and things.
Yeah.
Does that change with time? Like, is it good to have it done every 10 years or something?
Yeah, I mean, I don't think there's a hard and fast number on it. I would say it would be good to see maybe where you're at now, but quite frankly, so food sensitivity generally is not covered by insurance also.
Right. Oh, yes, I
And
know.
it is a big, I'm assuming did you get the MRT test?
I know I had a nurse come here and she took a bunch of blood and sent it to Florida, and it came back and I recognized the IgG and the IgA, and I don't know if the other ones are on there, but I got an extensive list of the green, the yellow, and the blue class of foods, and went on an elimination diet with that. So I would have to look again at the MRT to see if that's in there.
Okay, if it mentioned IgG and IgA, then it probably wasn't MRT. I was more just kind of curious if that's what you did or not. But it's I
Mhm.
would say if your symptoms have gone down, I don't know that I would suggest doing that. If you have resources to do that, it is always interesting information. And yes, your food sensitivities can change. So, like we talked about, if there is a struggle with digestion and that's how you were developing food sensitivities to begin with, then
Mhm.
yeah, for sure, food sensitivities can develop in other foods over time. Those
Mhm.
test results might also look different just because of the variance of, like we talked about, the results can vary in accuracy depending on what foods you were actually eating at the time that you were tested.
All right.
That can change things as well. So, and then you said it maybe has been like 10 years or so. So that test might look drastically different.
Hmm.
But I'm not sure that I would say it's worth, in my mind, it wouldn't be worth doing unless my symptoms were still showing um, that maybe there was still an issue.
And how do you feel about gut health with osteoporosis?
It can, I mean, they can all be correlated just because your gut is where you receive nutrients, right? And it has to do with what we're eating, but it also has to do with how we're eating. It has to do with other factors that are fighting against us. So if we have, let's say, a small intestinal bacterial overgrowth, so if you've heard of SIBO, the term SIBO, those are also producing byproducts that cause inflammation and start to break, they cause inflammation in that tissue and they cause the leaky gut syndrome. So there's all these factors that really are like, they overlap. There's a lot of Venn diagrams there. There's a lot of overlapping between all of these symptoms. And so if you have a gut issue that is affecting things like your parathyroid gland is actually what regulates the calcium that goes into your bones, um, then that could, if you're not getting the nutrients to support parathyroid, then yeah, there could be a correlation there. Um, and then there's other aspects of that too, which you've probably learned with working with Orit, is strength is a really, like, strength training is a really
Right.
big
Yeah.
part of bone health as well. Vitamin D levels, so there could be some indications that your body's actually not absorbing vitamin D or not converting it into the right kind of vitamin D. So there's a lot of different factors there, and those can all be impacted by gut health. Um, but
And do
it's really,
you work with figuring that kind of stuff out?
yeah, yeah.
Okay.
Hmm.
Because I know, I mean, like you say, there's so many factors and everything. And then I'm doing this whole thing with osteoporosis, and then the IC came up, and of course I'm working with that, and like so many things. You should eat this for this, but you shouldn't eat it for that. And so it's a conflict of all these foods, and it's like, oh my gosh, I'm putting charts together and trying to see which ones work and which ones don't.
Yeah.
And that's stuff that you can help with.
Yeah, my work is going to be more foundational. So I'm going to be getting, the first thing I do when I'm working, the process I use is called nutritional therapy. And so when someone comes to me and they want to be a nutritional therapy client, the first thing we do is get a very extensive intake. And that gives me a lot of information as to like what your symptoms are, what your lifestyle is like. We'll even do a food journal for 4 days. So we'll see like what are the foods you're eating, what's the quality of foods you're eating, what are your macronutrients like, things like that. So I'm getting this really big complex picture to help me then put the pieces together. So from there I can go, okay, so based on this information, I suspect maybe you have a candida overgrowth. So we get you tested for candida and we find out what's there. So then we're working foundationally, and then we're going, we have some specific data from the lab testing, but then we also have these foundational pieces. I can see if you're not breaking down fats properly, let's say. So vitamin D is a fat soluble vitamin. You may or may not be getting that if you're not digesting fats very well. And so what we're going to be looking at is, how is your liver health? How is the quality of your bile? That's what's responsible for breaking down fats. So we're working foundationally to work on adrenal health and liver health and digestion and possibly gut pathogens, whatever that entails. Um, I'm not going to be focused so much on the numbers of things, whereas your physicians probably are. That is more their training. And there is a place for that, but sometimes it can become, like you said, it becomes this complicated system of like, well, I can eat this, but not at this time, and I can't eat it with this, and I have to like make sure these things don't cross over. I think the work that I do is going to be a lot more simplified, and maybe you can combine it with, things that they might be saying, because it's not going to look the same for everybody. These things that they're telling you do and don't eat, it may not be true for you. Coming back to food sensitivities, a remark that I often got when working with clients at the old clinic I worked for, where we did MRT testing consistently, I would often get like, but I thought blueberries were good for you. Blueberries are a great healthy food, but your body is reactive to them. And so we're really looking at the individual components of how is your body responding to things, and maybe why isn't it responding, so that we can fix those things foundationally. That's the work that I do.
Okay.
Yeah.
Yeah. When I originally did this, I found I was trying to do a Whole30 diet, and I kept feeling worse and worse and worse. When I got the food sensitivity thing, I couldn't eat a lot of leafy greens and crucifers, and that was what and then it was like, wait a minute, like you said, this is supposed to be the good things. I'm not, now I can't eat them. So it was like throwing me completely.
And then what do I eat? Yeah,
exactly.
What are my options?
And you said most of this is not covered by insurance. Is it pretty much all of it not covered by insurance?
From what I haven't looked in, so I don't take insurance. And so I'm not familiar with what it's been for the last few years that I've been in practice solo. But at the time I was working for that old clinic, food sensitivity across the board was not covered by insurance. It didn't matter who your insurance was or who the provider was. They don't cover it.
Yeah. That's what I found out. They don't cover any of
It's a
this
luxury
stuff besides,
item.
no. You want to take a drug? We'll pay for it. You want to do anything else?
You want some surgery? Sure.
Yeah.
But yeah. Yep. So that's why I'm here. But yeah, it is unfortunate. Insurance is not covering that kind of stuff. So
thank you.
all right. Well, we have a couple more minutes left. Are there any more thoughts or questions or?
Okay, I'll say something.
Go for it.
You were talking about eating the same thing all the time and having that become a sensitive thing, possibly. Is that true also with your supplements and things?
I suppose it could be. And what I would say about supplements is, I think it depends on, the hard part with supplements is there's not often a practitioner who is monitoring that for you. So there's a lot of times when we're like, oh, I heard this helps for this, or it was recommended to us by a practitioner. We go and we take that thing and we just take it for the rest of our lives. I have clients who come to me and they're taking a B complex that they were told 15 years ago by a doctor to take. And I can see indications that their body's not even using those nutrients anymore. And so, I think it comes down to, in regards to food sensitivities, I suppose that could be a case, but those are already broken down into their nutrient form. That's a question I have not come across yet. So I would say because they're already in their nutrient form, they probably should be fine, because that's the issue, right? Is when it doesn't break down completely into its nutrient form, and then it's recognized as this foreign thing to your body. So I would say that those are probably fine. It makes sense to me that that's what would be the case. That's a really great question. All right. You guys can also email me your questions. I can put this, well, you'll get an email from me tomorrow. You can always just hit reply to that if you have more questions, or if you want, I can put this QR code back up on the screen for you.
Does your website talk about what it does cost?
Yes. Yeah. Okay. So the nutritional therapy program is $2,600, and that's for 3 months. And then I don't offer very many other services. I have a couple of online courses, and I can do like functional lab testing just on its own as well. And that is all on there as well. So that is the QR code. If you do have a question right now that you want to get to me, you can scan that and email me. Otherwise, you can just wait for the email tomorrow and just hit reply. You can hit reply anytime. I love questions. Just email me. All right. If there's nothing else, oh, I almost lost you. Let's stop sharing. I'm so glad you guys came tonight. Thank you.
Thank
Thank
you.
you.
All right. Hope this was helpful for you. And yeah, hit me up if you have questions.
Oh, the last
All right.
thing you said, you're all online. You don't do anything in office. Oh,
Yes.
okay. So if I
Yeah.
won't see you walking around town, I can't talk to you.
You might see me at Oreith's office because I am there regularly right now. I sometimes go to the Burien Farmers Market and have a booth there. So you'll see
Oh.
it's not a regular schedule. They do these like sponsored booths. Since I'm not technically a qualified like farmers market vendor, I don't create something, I don't produce anything. So I use these sponsored booth opportunities. So I'm there every once in a while. So if you happen to be there when I'm there, the next time I know I'm going to be there is August 15th, I believe. And I will be there in the afternoon. Oh, I'll be there in the morning that day. So, yeah, if you're ever at the Burien Farmers Market, you can swing by and say, hey. And I live in Burien and I'm around town, so you can always say hey anytime. So
You say you're at Oreith's office. Are you offering services there at Oreith's office?
no, I am a patient there.
Oh, okay. Well,
She's helping me.
I'm surprised I haven't run into you because in the last few months I was there 2-3 times a week. It seems like, but
Okay.
we're down to 1 time a week now. But
Yeah, I'm only there once a week right now, and hopefully that'll start to taper off. I'm starting to do better, but I always have something going on, so I'm sure I'm going to be back there. But I see Ernesto. I used to see Maria while I was there, so
I see
yeah, I'm
Ernesto.
in there every once in a while. She's talking about getting some like healthcare provider speakers there once a month, I think. So you might start to see me there for that. So you might see me there in more of a capacity, but yeah, I'm there as a patient right now. So.
Well, I love Maria, and I hated to see her go.
I know. I saw her there one day recently, and I was like, "What? What are you doing here?" And I guess she comes back as needed. So, but she helped me a lot. So,
I ran into it last week, I think, too. Yeah.
Yeah. Yeah. All their providers so far have been really great. So
yeah,
it's a good practice to be part of.
Great.
I feel like we're in this little club, right?
Yeah.
I mean, Bree, I don't know if you also go to.
I do. I've been seeing Oreith for a long time, off and on, but yeah.
Yeah.
So yeah, I'm a big fan.
She supplied the link for this, so
yep.
Yeah, she was kind enough to mention that for me. So yeah, it was very nice of her.
That newsletter she sends out gets me.
Well, I'm gonna have to
love
go.
her newsletters.
I have to leave.
Newsletters.
I have an appointment. I did at 7:30.
Okay. I need to respect your time. I'm gonna let you all go.
Okay.
Thank you very much.
Thank you
for coming tonight. Yeah.
Thank
you.
you.
See you guys.
Take care.
Bye.
Bye.